Hi everyone, thanks for listening to my presentations. Today I'll be talking about Leuprolide. Leuprolide. Okay, let's go. Leuprolide will come under different brand names like Lupron, Pensovie, and Zilide. Lupron is the commonest. Leuprolide belongs to the class of medications known as antineoplastic agents. It is a gonadotropin releasing hormone agonist. Leuprolide could come in different forms. For example, it could be intramuscular injection kit with medication at 1 milligram per 0.2 ml. Could be in the form of Lupron depot for monthly usage at 7.5 milligram, or Lupron depot for every 6 months usage at the dose of 45 milligram. Could also be in form of subcutaneous administrable form with different dosages at 7.5 milligram, 22.5 milligram, 30 milligram, or 45 milligram. And as a matter of fact, we even have more examples like 11.25 milligram and so on. Mechanism of action. Leuprolide is an agonist of gonadotropin releasing hormone receptors. It is an inhibitor of gonadotropin secretion. When you administer Leuprolide, initially, you are going to find a raised level of luteinizing hormone and follicle-stimulating hormone, testosterone, dihydrotestosterone, estrone, and estradiol. But if you continue, continuous Leuprolide administration, then you'll be dealing with a lower level because it's going to suppress the ovarian and testicular hormone production, and that is why we are using it. Still on mechanism of action, just the previous slide, because someone was asking me, if you give it, then how long will it take before it will have the inhibitory effect? That's why we give it depot, okay? Some will be administered on monthly basis and some on every 6 months. So continuous release of the medication into the circulatory system will then create the inhibitory effect. It may also have a direct inhibitory effect on the testes, okay? And in that case, there'll be a drop in LH and FSH. So generally, we'll be dealing with low level of testosterone, estrone, estradiol, and dihydrotestosterone. That is why we need it. Uses. Very useful in handling fibroids, endometriosis, breast cancer. In LGBTQ community, for males trying to become females, we can administer this medication as part of hormone therapy. In prostatic cancer, and of course in psychiatry ward, in paraphilia, which is a psychiatric disorder with abnormal sexual desires, e.g. transvestism. In gonadotropin releasing hormone agonist stimulation test, Leuprolide is the gold standard to identify CPP. Some is asking, what is CPP? It is central precocious puberty. Adverse reactions, because in life you have merit and you have demerit, right? There is likelihood of pain at the injection site. The heart rate could drop, that is bradycardia, headache, mood changes, drowsiness, nervousness, skin rash, and of course weight gain. Still on adverse reactions, there's likelihood of menstrual disorder, constipation, dysmenorrhea, hypersensitivity reaction, increased antinuclear antibody, abscess at injection site, upper respiratory tract infection, flushing. Still on adverse reactions, might be dealing with visual disturbance, peripheral edema, insomnia, diaphoresis, vertigo, increased migraine, increased lipid, vaginitis, testicular atrophy, and decreased hemoglobin. Still, an adverse reactions, asthenia, arthropathy, hypertension, anxiety, could worsen acne vulgaris, and in diabetic patients, particularly diabetes mellitus, there's likelihood of increased glucose, so you have to be careful. Increased calcium, so watch out in hypercalcemia, dysphagia, and the list goes on. Contraindications: hypersensitivity to leuprolide or its analogs, including any component of the formulation, will not encourage us to administer it. Okay? Pregnancy, no leuprolide. Breastfeeding mothers, no leuprolide. Dysfunctional uterine bleeding, no leuprolide. Now, here is the big one. This is confusing, right? Lupron depot, 22.5 milligram or 30 milligram or 45 milligram and all strength of Eligard are not welcome in women. Let me explain. This entire presentation is on Leuprolide, and Lupron depot is the commonest brand of Leuprolide available. But in women, we can use other strength, lower strength, but we cannot use any Lupron depot that is 22.5 milligram, 30 milligram, or 45 milligram. No, not in women. And all strength of Eligard, either 7.5 or 30 milligram or 45 milligram, no, not in women. In other words, we can use all this, all strength, all brand in men. But when it comes to women, you cannot use Lupron depot 22.5, 30, or 45 milligram. And you cannot use all strength of Eligard. So, women have restriction as per the dosage and the type of Leuprolide available on the market. 1. Androgen deprivation therapy may increase the risk of cardiovascular diseases. There is likelihood of sudden cardiac death or stroke. It's likely that QT interval will become prolonged, and you have the need of EKG to monitor that. And to those in the School of Cardiology will agree with me that when you have prolonged QT, you stand the risk of ventricular tachycardia from torsade de pointes. Okay? Prolonged QT to torsade de pointes, from torsade de pointes to ventricular tachycardia. If it is not corrected on time, the individual will get down to ventricular fibrillation. And if there's no defibrillation, there'll be asystole. And of course, without immediate advanced cardiac life support, code blue, well, the individual will end up in a mortuary. That is death. Okay? Decreased bone density is very common, particularly in those taking alcohol, and on a long-term basis. There's likelihood of exacerbation of endometriosis. It could worsen diabetes mellitus. Why? It increases glucose level. And of course, anaphylaxis is possible. Remember, hypersensitivity. Still part of the warning is, remember, this individual could have pituitary apoplasia, have psychiatric illness become worsened. CCL threshold could be lowered, which means little impulse of trigger will lead to seizures. Spinal cord compression in patients taking it for prostatic cancer is possible. If the individual is having tumor, there's likelihood of tumor flare. Urinary tract obstruction is possible in prostate cancer. Initial stimulatory effect can lead to vaginal bleeding. Not to be used by postmenopausal women. Drug-drug interactions. Well, because I may not be able to tell the exact medication you are using or about to use, at the same time you'll be using Leuprolide, then I cannot exhaust the list of drug-drug interactions. So my best advice here is contact your pharmacist, either as a doctor or a nurse or the patient using Leuprolide. Please involve your pharmacist. They'll be able to guide, because right now I can't tell which medication you may be using or you would like to use at the same time that you are administering Leuprolide. Contact your pharmacist. Okay, I just want to go over some few examples of where and when we can use Leuprolide. 1. Precocious puberty. And someone is asking, what is precocious puberty? That is when a little kid who has not attained the age of puberty has suddenly developed secondary characteristics. I mean, has developed everything. You understand what I'm saying? As per puberty, right? So you administer Leuprolide depot on monthly basis, and that will have therapeutic effects to suppress that unwanted early growth or early development from 2 to 4 weeks. Use Leuprolide depot pediatric monthly formulation is available, but you should discontinue. Please let me repeat. Discontinue Leuprolide depot when the onset of puberty is expected. Why that? Needless to say that you are going to continue to suppress that puberty if you reach the age of puberty expectation and you are still administering that medication. So you will be doing more harm than good. In endometriosis, Leuprolide only, or you can use Leuprolide with norethindrone acetate. So you can use your Leuprolide depot 3.75 milligram intramuscularly every month for 6 months. Or you can use Leuprolide depot 3 months, that is 11.25 milligram every 3 months for 1 or 2 doses. If symptom reoccurs, repeat the above with norethindrone acetate. So here you can combine 2 medications to handle endometriosis. If you remember, part of my warnings, contraindication in the past is don't use Leuprolide depot 22.5 milligram and above. You could see this is endometriosis. We've not reached that dosage. Here you could see 3.75 milligram. You could see 11.25 milligram. In fibroids, you can use Leuprolide depot 3.75 milligram every month for 3 months, or Leuprolide depot 3 months at 11.25 milligrams single injection. Let me explain something briefly here. Leuprolide depot -3 months means when you administer it, it's going to be there for 3 months. So you use that as single injection. IM could be combined with iron. The last example here is for transgender male becoming a female. You can use Eligard here subcutaneously. You can use Leuprolide depot intramuscularly, given as 3.75 milligram every month or 11.25 milligram every 3 months with other useful agents. Like I will always say, when it comes to all my presentations, particularly all medications, please consult your physician, consult your pharmacist. This medication is a very serious medication that could alter many things in you, and is also very expensive. Don't spend big money to get something that will destroy you. So seek appropriate medical advice, and if you are a physician or a medical student or a nurse and you're still confused, please contact the pharmacist in your jurisdiction. With that, I've come to the end of this presentation. Remember to share, remember to subscribe. I appreciate it.